With respect to MF, it is still a rare hematologic malignancy of the bone marrow. The characteristic feature of this disease is the presence of JAK-STAT activating mutations in three common genes. And these are JAK2, calreticulin, and c-MPL. And these mutations are seen in a mutually exclusive manner. That means that patients will have either one of these genes as mutated, therefore, we would consider these as driver genes. And essentially, these genes cause activation of the JAK-STAT pathway, resulting in essentially a clonal myeloproliferative process derived from the mutated hematopoietic stem cells. These mutations are also seen in polycythemia vera and essential thrombocythemia. If you take polycythemia vera, almost all of the patients have JAK2 mutation. In essential thrombocytosis, about 50 to 60% have JAK2 mutation, and calreticulin mutation is seen in about 20%, that is depicted in orange here. Primary myelofibrosis is also pretty similar incidence of these mutations. About half of the patients have the JAK2 mutation. About a third, 30%, have calreticulin mutation. In order to identify these mutations, we sometimes do targeted sequencing. We've talked a little bit about these driver mutations. So the JAK2, calreticulin, MPL, because they are mutually exclusive and present in about 90% of the patient, they're considered driver mutations, and they do impact survival. Of all these three genes, triple negative patients have the worst prognosis of all, followed by MPL and JAK2, pretty similar prognosis, but it's the patient with calreticulin mutations typically exhibit somewhat indolent course and have superior overall survival.